All right. So I just want to share a cool case today of something that just kind of came in to clinic. It's a patient I've been watching, but I've kind of figured it out a little bit now. Biopsies really helped me, but a really interesting case. So this patient has this history of this smoldering myeloma. So unclear exactly what's going on there, but she has this monoclonal gammopathy that's being monitored and previously is presented with some skin lesions. A couple years ago to me, I biopsied it and it showed vasculitis, thought that the myeloma was driving the vasculitis. And so treatment was aimed at the underlying myeloma and then the overlying vasculitis with things like colchicine, topical steroids, without a lot of success. So let's look at this photo here. This is a patient. This is the patient's extremity. And what are you seeing here? Your eyes are probably drawn to this main lesion. Sorry about the biopsy signs. You can see I did H&E and culture. But what are you seeing here? It's an oval, kind of red, almost violaceous brown plaque here in the skin. There's no overlying epidermal change. So you know immediately that this is a dermal process because there's no epidermal change. There's no scale crust, pigment change, hyperkeratosis, anything like that. And then in terms of dermal, you kind of try to have to predict what the most likely underlying cell type is or process. Do you think this is inflammatory, neoplastic, or depositional? Neoplastic, I think, is possible. I was considering some type of neoplastic processes, especially dermal processes like mycosis fungoides is one thing that I thought about with this. Um, Depositional, I think, would be a little weird. You can think about some forms of amyloidosis, like nodular amyloidosis, but likely you're mostly in the dermal inflammatory camp. And then if you're trying to predict the cell type, looking at this, you see this kind of reddish brown, almost violaceous color. When you see reddish brown, you think histiocytes. So you can think about sarcoidosis, necrobiosis lipoidica, non-Langerhans cell histiocytoses, things like that. And so I was between several things on my differential, not this entity that came back, but I wish I was a little bit more clever to put it together. This actually came back as necrobiotic xanthogranuloma, or NXG. And in hindsight, it makes a lot of sense. So clinically, it makes sense because it looks like it. It looks like a dermal inflammatory histocytic process. And it looks good for that, which is with this reddish brown appearance. One thing that's not amazing for it's usually periocularly found, whereas this was on the extremity, but it can be seen beyond or away from the eyes. And then clinically and by history, it made sense. So this patient has a smoldering myeloma, and we know that this is almost always associated with IgG kappa monoclonal gammopathies, but can also be associated with frank leukemias and lymphomas. So it kind of made sense in this case that this patient has NXG, and this biopsy just came back to my inbox yesterday. The treatment of NXG is very difficult. So the first thing you need to do is work it up a little bit further. So we know that it can occur in the skin, but it can occur outside of the skin, most commonly in the eyes. So this patient will need a referral to ophthalmology. And it can also occur within other organ systems as well, including the organs that are affected by lymphoma. So like your spleen and liver, GI tract, things like that. So this patient will need some staging as well. Treatment, you can treat it like a local inflammatory process, so high potency topical or intralesional steroids can be helpful, but mainly if it's perineoplastic, which I think it is in this case, you want to address the underlying issue. So I'm working with this patient's hematologist to put them on a proper therapy that hopefully will remit the underlying gammopathy and therefore hopefully remit the overlying skin disorder. So very interesting case, NXG. I think it's only my second case I've seen of this. It's very rare. You might notice if you've been looking around in Astute, there's also some other findings here. Note that the patient also has these lesions you might have noticed here. This is not what I biopsied today, but actually I biopsied this a couple of years ago. I can't remember if I mentioned it in this video, and it was shown to be small vessel vasculitis. So this is a very interesting case because I think this patient has this underlying myeloma that's driving small vessel vasculitis, which you can see here, as well as a very weird NXG type of process. So I hope you enjoyed this case and this video, and please like and subscribe if you want to see future videos similar to this. Thank you.